This episode of Distraction is sponsored by Landmark College in beautiful Putney, Vermont. If you've never been to Putney, Vermont, you ought to go visit. Landmark College offers bachelor's and associate's programs, bridge semesters, and summer programs for students who learn differently. To learn more, visit lcdistraction.org.
You know, we call it systematic desensitization. It's you do it with fear of heights, you do it with fear of spiders, well, you can do it with fear of sex. And just gradually introduce the topic over a period of months where you talk about sex a little bit and she'll say, ooh, that's gross and that's disgusting, and bring it up a little bit. You'll have to engage your husband in the process, and he'll probably be saying, that makes me very uncomfortable. This is very inappropriate. Don't want to talk about this. I have no intention of doing this. And, you know, everybody will be harumphing and grumphing.
Hello, this is Dr. Ned Hallowell for Distraction. Today I'm especially happy to welcome two of my colleagues from my center in New York City on 72nd Street in Manhattan. To be precise, 117 West 72nd Street between Amsterdam and Columbus Avenue. Two of our stellar clinicians, Christina Nichols, who has a PhD and is a therapist, a group facilitator. She works at the Horace Mann School in New York City, in addition to working at our center. And she's bringing along with her our latest hire, Elliot Weinstein, who has a master's in public health. He is an executive function tutor and an academic support specialist, also at Horace Mann. And they both run workshops at our center in Manhattan on ADHD and high-risk behaviors, which they're here to talk about. And they also run workshops on making the adjustment from high school to college, which is one of the most fraught transitions that people with ADD ever make, that transition from going to high school to college. So if you have a son or daughter who is a senior and looking at going to college in the fall, you ought to give our office a call and sign up for one of those workshops. It's a really valuable experience to get ready for the fall. Our phone number is 212-799-7777, and you can sign up for one of the workshops. So Christina Nichols, our tremendous coach and group facilitator, Elliot Weinstein, our ever so talented executive function tutor, academic support specialist, and group facilitator. Welcome to Distraction.
Thank you so much for having us.
Thank you.
Welcome, welcome, welcome. Well, you've brought along some questions, and jump right in.
All right. So I think the first question comes from David. David is at a high school in New York City and was diagnosed with ADHD back in the third grade at a time in which his academics had not yet been compromised. When his grades started to drop at the start of middle school, his mom, in consultation with his psychiatrist, decided to start treating his ADHD with medication in addition to weekly therapy sessions. Since then, David has taken medication every day, but feels like he's lost a major part of his personality each time he takes his normal dose. And he says it's not just himself that has noticed this change in behavior, but that his friends have also become more aware of those changes and like to tease him a little bit about it, often saying, "How have you become such a robot when you're on your meds?" The changes in his personality have gotten so difficult that he's thinking of no longer taking his meds on weekends or on nights in which he plans on going out for social engagements. He wants to know if there's anything that can be done to help him get his fun personality back, and what the drawbacks would be if he ended up stopping taking his medication a few nights a week.
Well, absolutely, there's something that can be done, and it ought to be done yesterday. He ought to talk to his doctor and get off that medication. Now,
I don't mean just stop it abruptly, but the medication, the dosage ought to be changed, or he ought to be started on a different medication. This kind of side effect is absolutely unacceptable, and it should have been changed a long time ago. Change in personality is simply unacceptable. My standard with patients I have taking medication is I want to have target symptom improvement, namely improved focus, improved performance, all the reasons we're giving the medication, with no side effects whatsoever other than appetite suppression without weight loss. You almost always do get appetite suppression, but you've got to eat enough so you don't lose weight. If you lose weight, that's unacceptable. So I want to have no side effects other than appetite suppression without weight loss. Change in personality, unacceptable. You have to lower the dose or change the medication. Otherwise, you can't take medication. These side effects are unacceptable. And the fact that he's being called a robot and still taking the medication, that's wrong. That shouldn't happen. If he's told his doctor about it and the doctor is doing nothing, shame on the doctor. That just shouldn't happen. If he hasn't told his doctor about it, he should. This just shouldn't happen. That's what gives these meds a bad name, when people continue to take them in the face of unacceptable side effects. These medications are absolutely not supposed to change your personality. They're not supposed to take away your zest, your special sauce, your sparkle, your pizzazz, your creativity. Not at all. And if they are doing that, you have to change the medication or stop it altogether.
So some things I have heard from people with medication is that there'll be some irritability at the end of the day, right? You're nodding. That's a pretty common side effect. And what I often discover is what you're mentioning about the suppressed appetite. So one of the helpful things I like to discuss with people who are dealing with this symptom is to grab some lean protein or some almonds, because irritability is increased when we're hungry. So that could be just something in the afternoon that you can just have in your backpack or have in your purse, and that could just be something that helped that afternoon smooth out a little bit. But I understand they could speak to their psychiatrist about that as well. Yeah,
my wife taught me the word hangry.
Yes.
When you're hungry and angry at the same time.
Yeah.
It happens to her a lot. She's hangry.
The common ailment.
Yeah, exactly.
The hangry attack.
Exactly.
Right. Yeah.
All right, great. So I think we're ready to go to the next one. And I'm just going to talk from the eye like that it's an email from Arnie. So Arnie sent us a direct email. Hi, my name is Arnie. I'm a senior. I was diagnosed with ADHD sometime during 7th grade and have been on medication since I started high school to help with focus and organization. I'm really excited about starting college in the fall and the possibility of making new friends. While I rarely, if ever, drink or use drugs in high school, because my friends don't, I'm curious about experimenting with drugs and alcohol in college, to get the full college experience. My question connects to the effects of substances on people taking drugs treated with ADHD. Is there anything bad that will happen if I drink while taking my ADHD medications? And what about if I take drugs like marijuana or cocaine? If I'm going to experiment with drugs, is there any way I can do it safely?
Well, you probably will experiment with drugs, but I am here to urge you not to. So let me tell you why I'm going to urge you not to. About 50% of young adults with ADHD develop substance use disorder. Substance use disorder is a brain disease that is chronic and relapsing and lasts the rest of your life. It is a brain disease you really don't want to develop. And the way not to develop it is not to use drugs at all. So not to experiment with alcohol, marijuana, cocaine, opiates, the full list. Now, you may say to me, dream on. Well, okay, but I like to dream. So I'm telling you, the best thing you could possibly do for yourself with ADHD is not to use drugs. Now, you may say that's impossible. Well, it's not impossible. It is possible. And I'm telling you, the best thing you could possibly do is not to use drugs. Now, the medical facts are, If you're taking stimulant medication and you have a beer, that's not medically dangerous. They simply counteract each other. You're better off if you don't have that beer, but it's not like taking Xanax and combining that with alcohol, which is medically dangerous. So it depends upon what medication you're taking when you combine it with alcohol. Again, you're better off not combining alcohol with any prescription medication. So if you are taking prescription medication, you're better off not using any recreational drug whatsoever. The fact is, people with ADHD are at tremendous risk for developing substance use disorder. And when you develop that, you are opening the door to a lifetime of struggle, to a lifetime of dealing with a chronic, relapsing brain disease. There is treatment for it, but it's a chronic disease that there's no cure for. There's only treatment. And it's a terrible condition to be wrestling with for the rest of your life. You know, there's many good parts to having ADHD, but the vulnerability to substance use is one of the worst parts. I'm just giving you the facts, and do with them what you will, but try not to laugh it off and say, oh, come on, I'm having the full college experience. You don't want the full college experience to be ending up in a coma in an emergency room.
Mm-hmm. And I want to say bravo to Arnie for even contemplating this, because the fact that he's reaching out and talking to us about this is a really nice sign. He's planful and he's thinking this through. And it's not uncommon for kids to want to experiment. Just that combination, like what you were saying, Ned, is lethal. And it's just an experiment that's too risky to take.
And I know that I remember from my college days in which people would experiment with substances like cocaine or speed because they thought it would give them a leg up academically because they could stay up all night and study. And it became pretty clear that maybe that helped on one test, but after a while, these students would be missing class because they'd be recovering from benders. Once they got to the exam, they would have a really hard time remembering the information that they had studied really hard for, so they would have memory loss. And it became pretty clear that it just wasn't an effective strategy for studying and keeping your grades up. So I would really stay away from these drugs. There's other ways to help maintain high grades in school. There are other strategies that you can develop that doesn't include substance use.
Yeah.
So our next question is from Taylor, and she says that my name is Taylor, and I have ADHD and dyslexia, and I'm in my second year of college. While I'm fortunate that my school has given me a series of accommodations, including extra time on in-class assignments and at-home papers, I have a bunch of reservations about using these accommodations due to the stigma of extra time and disability accommodations. First, I have to hand the form over to my professor the first day of class, which causes me a lot of stress. Having my professor know from day one that I need extra time because of my ADHD is not exactly the first impression I want to make. Second, in addition to not wanting to be labeled right off the bat by my professor as the ADHD kid, I'm also afraid of what other students will think of me if I begin to use these accommodations. What's your advice on how to handle a situation like this?
Well, you know, it's too bad that there is still this shadow of stigma, but it is diminishing year after year. And I would say, you know, go ahead and take advantage of the accommodation and try to just ignore whatever negative repercussions there might be. I think you imagine them to be much more severe than in fact they really are. ADHD is much more now in the mainstream, much more accepted. I don't think anyone is looking down their nose at you the way they might have been, say, 10 years ago. And I think the risk-benefit analysis comes down clearly on the side of getting the accommodation as opposed to not getting it so that you won't incur whatever minimal disapproval you think you might receive from the professor and your peers.
Yeah, actually, I think if your professor can recognize that if your eyes drift off a little bit during a lecture, it's because you might be struggling to pay attention. And you actually might find your professor is more receptive to you now that he or she knows a little bit more about who you are as a student. And you never really know. It's possible that your teacher could be neuro-different, right?
Yeah, totally.
This person might have had some struggles, so there might be an ally over there that you didn't even know about. And I agree. I'm really excited to see that there is more and more education happening in graduate classes. 20 years ago, I would spend a lot of my time speaking with teachers about neurodiversity. And now everybody that I work with, and we're really lucky at Horace Mann, that it isn't an issue. I really find people leaning in and wanting to know more.
Yeah.
And I think from the peer perspective, honestly, people are more concerned about their own performance than they are about the performance of others. And true friends are really going to be supportive of you if these accommodations are going to help you succeed in school. So I wonder if actually maybe these friends haven't even thought about the consequences of their teasing. Yeah. And in my opinion, if you have a friend who's more focused on teasing you and making you feel bad about accommodations that are supposed to really help you, they may not be the type of friend you want to have anyway.
Yeah.
So maybe thinking about those friendships and what they really mean would be helpful in a situation like this.
That's true.
Yeah, I can't imagine you'd stick with a friend who was teasing you
Right?
about accommodations.
Yeah. Okay, so we have one from Jamie. My name is Jamie, and I'm currently a sophomore at a state university. I've been a good student, but as my course load has gotten harder and more intense, and as my extracurricular activities have become more demanding, I've started to struggle maintaining my grades. I'm part of a sorority, and I've taken on a leadership role, which has taken more time than I expected. I notice that I start to get stressed on Sunday morning, and it becomes harder to concentrate. As much as I try to stay organized and plan ahead, I feel as though my ADHD makes this a challenge. Not only do I have a hard time distinguishing between which thing to start first, but I also struggle to remember what I've already completed. Do you have any suggestions on ways to stay organized? Are there any resources that you can suggest I start using?
Well, I think you ought to go find someone like Christina Nichols or Elliot Weinstein. Can you describe the services that you both provide?
Yeah, one thing is great is that most college campuses have people like us that are located either in the counseling offices or in learning resource centers. So I agree. Start connecting with your resources. You also hopefully have had other people in your life that have helped you along the way. So this might be time to reconnect with someone who has helped you treat your ADHD or who's provided individual counseling. And also, I really do like to work with coaches and other psychologists that can help you take all the great things that you're doing. Because, Jamie, it sounds like you have a really good plan in place. You have the beginning of a good plan. And it looks like it might not necessarily be a time management problem, but it looks like you just might have so many things going on. There might not be enough time in the day to take care of it all. And that's a really great thing. And it's pretty common with kids with ADHD, and they just take on so many exciting opportunities in college. So one thing I would like for you to think about, and Ned talks about this a lot, is take a look at what your tasks are, see if there's something that you can delegate to someone else. Maybe you said you're in a sorority. Maybe there's another sister who could take on some of those leadership responsibilities. Or you can work to strengthen your organization and planning system.
Yeah, and I think it's totally appropriate to feel a little bit overwhelmed in college, especially when you have a burgeoning social life and a jam-packed academic schedule. And so I think the idea of really focusing on calendar management is huge. And most people think, oh, I have a calendar, all I need to do is put in my assessments and major social events. But in reality, to really have an effective calendar where you feel on top of your organization, you have to schedule in time for everything. So that includes academics, your social events, your personal free time. So that means going to the gym, the exercise routine, even your retail therapy, your shopping, putting that into the calendar, and sleep too. And that you'll find that once you do that, you'll find and you'll rescue time that you think was lost, and you'll feel more organized to help plan for future events.
Yeah. And then it is pretty common to get a little nervous on a Sunday when you're looking at everything that has to happen during your week. So in addition to taking a little time to organize what's going to happen during your week, like what Elliot was discussing, this is a really great time to practice mindfulness and meditation. And if this isn't already a practice that you have developed, there are so many different resources. In fact, there's even apps on your phone. There's one that I recommend a lot called Headspace, in which they can talk you through. It actually has a cartoon on it, and it can talk to you about the benefits of just taking a little time for yourself, bringing yourself to calm. And you can get very skillful at what we call eliciting the relaxation response. And you might find that you might be able to improve your concentration at that time, and you might be able to use the time you have more efficiently.
All right, if you could hang on for just a moment while I tell our listeners about our sponsor, Landmark College. All right, well, I've been telling you lately about the great work going on at the Landmark College Institute for Research and Training in Putney, Vermont. Today, I want to tell you about a couple of the workshops that are available to educators. Over the years, the Institute has partnered with hundreds of schools and colleges, providing relevant and practical professional learning to thousands of educators around the globe. If you're a teacher, they'll bring professional learning to your school or college on the topics you want when you want it. And all of their work is based on a core group of classroom-tested components that promote academic success for students who learn differently. Current workshop topics offered by the Institute include Dyslexia Training, the crucial role of executive function in student success, teaching math, why students struggle and what you can do to help, teaching supportive study skills, and many, many more. This kind of training is very important for teachers because students just get lost in all of this, and teachers need to be able to offer them guidance, around executive function, around learning math, around planning and study skills. It's not just the subject matter teachers need to be able to master, but helping kids gain access to it. As Priscilla Vale used to say, finding the right way in. And so it's very important that teachers learn these kinds of disciplines. If you'd like to learn more about the programs offered to educators through the Landmark College Institute of Research and Training, go to lcdistraction.org and click on Research and Training. All right, now let's get back to the show.
Great. So the next question comes from Clark. Hi, it's Clark. I'm 25 years old, and I'm living with ADHD. Holding a job, having a social life, and dating all at the same time has been a little bit challenging. By now, while I think I have handled my ADHD on the job well, and I'm pretty content with the friend group that I've developed, I'm still a little unsatisfied with how my dating life is going. Is it a smart idea to try and find a partner who also has ADHD, or should that be something I try to avoid? I've heard the arguments for both sides, that it may be really nice to date someone who can relate to you and who gets you on a more intimate level in regards to the challenges of ADHD, as well as the idea that opposites attract. What do you think is best? Would dating someone else with ADHD be problematic?
I'd completely forget about ADHD and find someone you like. And whether they have ADHD or not doesn't matter. You're not going to wake up to someone and say, well, do you have ADHD? If you do, I'll date you. If you don't, I won't. I think you just want to find someone you like. And if it's irrelevant whether or not they have ADHD. It's all a matter of finding somebody you like. And when you say opposites attract, if you have ADHD and someone else doesn't, that doesn't mean you're opposite. It means you're different in certain ways, but it certainly doesn't mean you're opposite. So forget about it and just look for somebody you like and take it from there. What do you guys think?
No, I'm with you the same. I think the same thing. I just think there isn't really a science to love or passion and who you want to be with. I think it's really important to find someone that cares for you and that you have passion for.
I have ADHD. My wife doesn't, but I don't think it would have been a mistake if she did have it. It's just,
There's no formula for dating.
Yeah.
I think it's the idea of trying to determine a list of characteristics and attributes that you really hope you'll find in a mate,
Right.
and then try to find partners that have a large number of those characteristics.
Yeah.
If they end up having ADHD, great.
Yeah.
If they don't, that's great too.
Yeah.
You just want to make sure you have some sort of connection with the person and they make you feel good.
Yeah.
I love that you said great there. If they have ADHD, that's great because it's true. It's all great, right? We all come to relationships with different lived experiences and just just be open and receptive to people in the world. And I think it'll be all right.
Could we just tease the two workshops you run a little bit? Because you do one on ADHD high-risk behaviors. What are the high-risk behaviors you touch on in your workshops?
Yeah, so the way that we have it set up is like a typical Saturday night for a young person.
Mm-hmm.
And so we help people kind of think through a little bit about what choices they're going to make in terms of where are they going to go, what has happened recently, have they been going out and getting blackout drunk, and if that's something that's going on, take some time to take a look at it. If you're spending time with other people that are engaging in high-risk behaviors, we kind of deep dive into all kinds of things that can happen on a college campus.
So sex, drugs, and
rock and
Everything.
roll, we got
Right.
everything.
Exactly.
Yeah.
And
And helping sort of students develop strategies for planning on sort of like buddy systems, an idea of what happens if something goes wrong. How do you say no?
And you have better ways of dealing with it than just saying don't do it.
Exactly, right.
Yeah.
We come up with strategies because we know kids are going to experiment. Students are going to be put in situations that they may not have even prepared for, but we want to give them the skills to navigate that in a way that isn't just say no, but maybe, okay, but let me try it a slightly different way, a way that makes me feel more comfortable.
Right, and we present them with novel situations and then help them think through what they would do in a situation in the hopes that will kick in when they're faced with a challenging moment.
And since it's a workshop, it's not a lecture. It's a group setting where they learn from each other.
Definitely.
Yeah.
Exactly. And it's open to everyone. People from all different backgrounds, LGBT students, students of color, neurotypical students, people with ADHD. It's really for everyone to sort of come together and learn these skills.
Mm-hmm. And then you're one on making the adjustment to college.
So that one connects a little bit more to these strategies on time management, improving study skills, dealing with being away from home maybe for the first time, and developing support systems in a new location.
Yeah, and also different things like dorm living and how to be with people who maybe have a different political opinion in the world and how to engage with a roommate and ways to talk about things directly. And again, it's another one of those things where we are really... we give little scenarios. We have us kind of share some of our own experiences, it's a lot of fun.
And you get ready to get up on your own without mom waking you up and
Yes,
get your laundry
alarms,
done.
yeah.
Laundry, all these important skills.
Because
you need.
it is real, though.
Yes.
It's an awakening when you're in college.
Right.
Literally.
There's just a lot that your family used to do for you, right? Yeah.
And if they're interested, they should just call the center in New York?
Yes.
Yeah, that's,
And
I'll give the number again, 212-799-7777.
so we're having group meetings in New York City, but Elliot can be available to modify this for people all over the country where we can share some of the scenarios and lessons learned in group.
Wonderful.
Got it.
Well, this is terrific. Thank you all, both of you, for coming down. They came in from Manhattan to our studio, and it actually was snowing this morning, so it was not easy to get here. Should we do one more question?
Oh, yeah, I hope so. Let's see.
So this one actually comes from a parent. My name is Betsy, and as a parent, I'm always trying to do a better job with my child compared to how my parents approach things with me. With that in mind, as a young girl, my mother and father never, ever talked about sex with me. Sex and relationships were taboo topics in my household growing up, and I learned everything I needed to know about sex, both correct and incorrect information, from my friends and reading. I definitely don't want to create this culture in my household today, and I certainly don't want to make the same mistake with my daughter. Whenever the talk about school crushes or relationships come up at home, my husband begins to act really weird, even when my daughter is talking about these themes appropriately. While I try to talk to my daughter about her crushes, it never goes well because she either gets overly embarrassed or frustrated that I'm intruding into her life. I'm just trying to provide support to her and inform her about things connected to sex, love, and relationships that I wished my parents had provided me. How can I help her listen?
Well, how old is she?
She is in 8th grade, 13, 14.
Yeah, okay. So you've had 13 years of avoiding the topic. So it's sort of like it's a little bit late to get started on it. It's not too late, but I'm just saying it would have been easier had you sort of started sooner, but what do you guys think?
Yeah, I mean, that is exactly what I think as an educator.
Yeah.
A lot of times in our school, we ignore the subject at all.
Right.
And in 3rd grade or 4th grade, we separate boys and girls and then forget about people that are like gender nonconforming. That's not even part of the conversation.
Right.
And then they talk about like menstruation and then puberty and then that's it. And then everything gets quiet until high school, and then it's sort of like sex, STDs, don't do it.
Only for heterosexual relationships.
Only heterosexual, that's it. The rest of it isn't discussed.
Right.
So I agree with you that there are ways that you can talk about love and age-appropriate ways in kindergarten and 1st grade, and you can teach people about, little kids, about boundaries and space. And having those conversations early on makes growing into these conversations as they get older more comfortable. And if you start doing that, these are for other people, Betsy. But Betsy, we're going to talk to you about this in a minute. But this can make these conversations more natural, and we hope that you can get there first before they're going to see things on the internet, before they hear things from their friends, or at least creating an open environment in which they can have that dialogue with you.
I think in this particular case, I would sort of begin by talking to your husband and saying, we've sort of made a mistake here. And why don't we kind of acknowledge that and say to our daughter, Betsy, we've been kind of uptight about this, and we don't want to pass that on to you. And sexuality is a part of life, and she'll get totally nervous when you say that. And you can say, you can hug him and sort of say, I'm attracted to your father, and she'll go, oh, ooh, that's disgusting, and you can say, I know that's the message we've given off, and we should avoid it. And you can make a joke about it a little bit, and you can gradually do, we call it systematic desensitization. Is you do it with fear of heights, you do it with fear of spiders. Well, you can do it with fear of sex, and just gradually introduce the topic over a period of months where you talk about sex a little bit, and she'll say, ooh, that's gross and that's disgusting, and bring it up a little bit. You'll have to engage your husband in the process, and he'll probably be saying, that makes me very uncomfortable. This is very inappropriate. Don't want to talk about this. I have no intention of doing this. And, everybody will be harumphing and garumphing, but if you want to do it, you can do it. But it'll take a period of months at least, for systematic desensitization. The same way you get over a fear of spiders, you can get over a fear of talking about sex. And I think it's worth doing because you don't want to ever carry that with her for the rest of her life. You see adults who literally have a very inhibited, intimate life because they actually don't want to be naked in front of their spouse. I mean, it's very inhibiting if you carry this with you into adult life. And so it'd also be good for you and your husband to loosen up a little bit. And it's this basic process of systematic desensitization, which you can apply. The same process that gets you over a fear of spiders can get you over a fear of sex.
I think that those are really great points, Ned. And also, I remember totally feeling awkward when my parents broached the topic of sex to me when I was a teenager. But I really valued my parents' persistence in pushing the subject and their ability to speak frankly and directly about the topic. It was really important to me to know that open communication was always there and that it was sort of a core value that they instilled in our household with me and my sister. And it was nice to know that they were there as a shoulder to cry on if maybe a breakup didn't go so well. Someone to brainstorm with, that there were maybe challenges as I started to enter into sexual sort of adolescence. And then also someone to just share the highs and lows with when you have a new school crush. So I think, Betsy, that's something to just remind your daughter, is that you're here for a variety of reasons to talk about sex, love, and relationships, not only for when something goes wrong, but when also things are going really well, too.
Oh, right. Yeah. It doesn't always have to be that awkward conversation.
Exactly.
Right.
Christina, yeah.
Oh, good.
Do you want to do one more?
Yeah. This one's really fun.
Okay.
Okay. So actually, this one doesn't have a name attached to it. I have 2 teenage daughters, one who's 16 and one who's 13. A few weeks ago, my husband and I went away on an overnight trip for our anniversary. Our 13-year-old was staying with a friend from camp, and my husband and I decided to allow our 16-year-old to stay at home alone, since it was just an overnight trip. We explained to her that while we trusted her, there were a few rules we expected her to abide during her time alone, the most important being no visits from the boyfriend. Don't get me wrong, my husband and I really adore our daughter's boyfriend, Frankie. It's just they don't feel comfortable with him hanging out alone in our house with no one else around. While our daughter agreed not to have Frankie over, my husband and I returned from our trip. I found Frankie's school ID on the floor of my daughter's room, and while she was taking a shower. While I never want to go into a situation not trusting my kid, I'm wary about being too overly gullible and trusting them, especially as they continue through adolescence. What advice do you have regarding if your child is broken your trust and how to help them regain it?
I'd be interested in what you both have to say, but I think trust is too loaded a word. I think you have to say more like sometimes we all don't necessarily tell the truth. And I found this driver's license, which makes me think maybe this is one of those instances. And, it's not that I'll never trust you again, but I'd really like you to tell me the truth. What actually happened? And, let's have it. And I'm not going to punish you or never believe you again, but, I'd like to know what happened.
And I really love the way that you said that, like just easy and gentle and calm. And there's part of you, I think, that knows that the kid's not going to be able to be honest right there. I mean, we want them to be honest, but I think if you go into it recognizing that the kid's kind of in a bad situation there, at 16 is a really vulnerable time. A lot of kids, if they have the place by themselves, they're going to take advantage of that situation. So in a way, your daughter inadvertently was kind of set up to make a bad choice there. So one thing you can do is to have that conversation and move through it very quickly. And I really like the fact that you said it was so loaded. Just if they lie in this situation, this doesn't mean they're going to grow up to become like antisocial or some kind of like liar. Right there in that moment, it was hard for them to be honest with what went down.
And teens are impulsive. Developmentally, 16, we're making very quick decisions, and they're not always the right decision.
Yeah, mostly not.
Right, exactly. And so your daughter may not have even wanted Frankie to come over, but one thing led to the other, and then Frankie was over, right? And so I think having this open communication is important, and saying, just because maybe you made a mistake this time, it's not that I'll never trust you ever again, right? It's this idea that sort of acknowledging the fact that this is going to be a process. You may make a poor decision. Tell me instead of hiding it. Let's talk it through, brainstorm it in the moment.
And we're recognizing that their frontal lobes are not fully developed yet. And even though your daughter is 16 and you can probably see her intellectual improvements and she might seem really mature, but she still kind of has her toe in childhood and taking a step into adulthood. And so it takes time for all those structures in the brain to be built. And it's not until, sadly, till they're 25 years old.
Got 9 more years of this.
Where they're going to be able to really take some time and reflect and be able to consider consequences. So you could just let her know that you're going to keep an eye on things in the future with her a little bit, just so that she's not even in that position to have to lie to you again in the future.
Well, Christina Nichols and Elliot Weinstein, thank you so much for coming all the way from New York City to join us for Distraction. Tell us again about the workshops you're running in the city.
Right. So we have 2 sets. We have a high school workshop and we have a college-age workshop. And They're 2 days long, and you can participate in one day or the other, but we recommend that you come or have your child come for both days. And it's a lot of fun. We have 8 to 10 kids per group.
And what are they about?
And we talk about all kinds of things that happen to kids in college, and we try to help them think through some of the choices that they're going to make in the hope that when they're faced with some difficult situations that they can make some better choices.
Wonderful, wonderful. And if they're interested, what should they do?
So they could call the Hallowell Center in New York City and let them know that you'd like to get part of the, what's the name of it again, Real Life?
The Real Talk.
Real Talk,
The Real
yeah.
Talk series.
Yeah,
Wonderful,
Real Talk
wonderful,
series.
Wonderful. Well, and I can't imagine two more qualified people to lead these workshops.
you,
Thank you so much.
Thank you. Thank you very much for coming and joining us on Distraction.
Well, thanks so very much to Christina Nichols and Elliot Weinstein. They are both very talented individuals I know firsthand. And their subject, the risky behaviors in ADHD, it's such a simple term, risky behaviors, but my goodness, they cost lives, change lives, damage lives. From driving car accidents to drug and alcohol abuse to problems with money management to gambling to sexual promiscuity and all the problems on college campuses related to sexual encounters. I mean, it's just a long list of catastrophes or near catastrophes and various kinds of disasters, and they're really good at helping kids negotiate these really troubled waters. So I was really happy to have them join us. I hope you'll consider taking their workshops. They're excellent, and they both have in the trenches experience, which is the best kind. Real pleasure to have them on the show. Distraction is produced by Collisions, the podcast division of CRN International. Collisions, podcasts for curious people. Our producer is Sarah Gurton, and our audio engineers are Scott Person and Greg Session.